And I kind of looked at things occupational therapy can do within the acute setting and kind of why it's important for it. So I have like OT and PT in acute setting. So I looked at a study and it looked at the efficiency of combining daily interpretation of sedation with physical and occupational therapy on functional outcomes of patients receiving mechanical vents in the ICU. And what they found was whole body rehabilitation was safe and well tolerated, and it ended up showing shorter duration of delirium. They had a better discharge outcome, and they were on the vent for less amount of time. Healthy individuals even begin to atrophy within 72 hours of being in bed. And then it was found that older adults atrophy even faster than the younger ones when in bed rest. So we know it's important that we need to get them out of bed and be moving. And intervention groups had higher ARCL index scores and after discharge, and more of them went home, the ones that received the therapy. And then 30 to 50% of patients in the ICU will suffer from generalized weakness, and then 50% of those patients will completely recover after 4 to 12 weeks, and then sometimes it takes them up to 4 months. Another study showed that some therapists feel that some of the barriers with these patients are the patients have a fear of pain, so they don't want to get up. They're afraid it's going to make them hurt worse, and I know we see this a lot, especially after surgery, but it's actually really good for them to get up moving. So, and then some of them have like a depressed mood, so they don't want to get up. They don't have that motivation to get up, so that's kind of our job to come in there. And then they found that individuals with cognitive deficits also weren't really motivated. And then another study found that the client's inability to participate, so that decreased their participation, and then lacking of organization within the sessions, and then financial also led to some barriers. So why have our patients participate? So poor participation in therapy and other studies show that it leads to lower improvement in the film scores, and then they end up having a longer stay in the hospital. And then for poor participation, inpatient rehabilitation was found to be the most common for that. So how can we increase our patients' participation? Just motivating and encouraging them, creating that just right challenge, and then finding things that they find important to them, so using that client-centered approach too. So looking at some things we have here. So when Andrea and I were talking about this, we were thinking about like things that we have here, things that we could bring, and how different items can be used for different things. So the ADL items, you don't just, you don't look to see, can they brush their teeth? Turn it into a cognitive task. Like Alexis was saying, like make them find that item. What do you use? Or for cognitive deficit, showing them a brush and a toothbrush and like, what do you use to brush your teeth? Things like that. And if they have upper extremity weakness or neglect, the placement of that item, where they get that from. For the mirror, so there's mirror therapy, to have them like visually track. I know with some of our patients, just having them follow it, can they cross midline, things like that. Showing the patient their posture in the mirror so that they know, hey, this is what you're doing and this is how we can fix that as well. Weights, they're available. Pinterest has good ideas for those as well. Standing frames and tilt tables, so not just getting them up in that, but also having them do something functional while they're there. Increasing their tolerance for being upright, and also working on other things. TheraBand, we have that available. And TheraPutty, there's some really good things for like fine motor strengthening exercises for those. And then a ball, just making it, you can make it a game, you can work on functional endurance while standing, making it cognitive, having them keep score, having them reach in different planes and working on different things too. Scavenger hunts can be good. I know we've taken patients out in the hallway and have them look for items, locate it, so you're working on visual tracking, giving them a list of things to pick up, or like telling them, so you're working on memory. When we go out here, we're going to look for this, this, and this, and then having them actually retrieve that item. So even working on like bending down, are they safe when they go home to get something up off the floor if they drop it, or from higher levels? So there's many things you can incorporate into that as well. Taking a trip, so having the patient, you can have them map out where we're going and seeing how well they can follow directions, and then taking them to the gift shop or taking them to Starbucks or something, having them order for themselves so you can work on social skills, the higher functioning tasks like money management, and seeing if they're able to do things like that. Meal prep, so you can work on sequencing through the task, memory, have them like make a list of what we need, having them get the items, and then actually completing that task. Some more of like the higher ADL things that they need to do for patients that have been here a really long time, that some of us have. So beds, so we can work on bed mobility, which most of us do all the time. And then also, I know we've had a patient before working on those IADLs of even we had him like make his bed before. Within his room, does he know where to put his dirty sheets? Can he remake his bed? Does he know the steps for that? Things like that. And then showers, just teaching them how to do it at home and be safe. Everyday cheap items that we could bring that can be cleaned and brought in and out of patients' rooms. So just cards, I know, like laying them out, having them visually scan. You could even do like NDT with one hand and having them reach with the others, working on some of those functional tasks. Sequencing through, are they able to put the cards in order by color and by suit? So different cognitive things can be done with that. Dice, like in-hand manipulation, like cognitive things, just like have them, hey, if you roll a 2, tell me something about yourself, or things like that. Paper and pen tasks are really good for visual tracking as well. And then tic-tac-toe at the board, done that before, so that's cognitive, and then also like functional endurance. And then for like the closet and laundry basket, having patients get things out of their closets. So again, you can either work on like walker safety with them. Are they going to be able to do this when they get home? Do they know how to keep it with them and still perform the task? And bending up and down and getting things. The laundry basket, I know one of our therapists was talking about using it as like a basketball goal, the one within their room. So just using what you have available and having them keep score and like throw a ball from different. Or even having them like pack their laundry. Is this something they can do when they get home safely? And then puzzles are also good too. You can work on those while standing, and it gets some fine motor in there. And then some ways you can bring therapy to life. Like I know in school, our teachers talk about having like their therapy bag they take everywhere with them. It's like a bowling set. You can work on coordination, you can work on endurance, and just those movements out of, work on upper extremity. Golfing, just things to get them standing. Board games are really good as well for cognitive and using that fine motor skills they have. Executive functioning tasks, there's a lot of resources online. You can have them fill out a checkbook. Are they going to be able to pay their bills, fill out a check, things like that. Even like crumpling up paper and then throwing it, that can work on many things as well. And then there's things like finger twister, having them sew. And then the patients that have been here a while too, even like gardening. And then also had a professor that packed around like a fishing pole that would have the patient like casting it, so working on that dynamic standing balance and things like that. Any questions?
What is finger twister?
It's like this little board, and it's like twister but for your fingers. So you're like having to move
So like
them.
index finger red, middle finger
You
green.
spin it and put it, yeah. It's like putting your finger.
Why have we never played that?
Get one.